Hi everyone, this is Khushboo Agrawal. I'm a resident at the University of Chicago and I'm here at the ARVO annual meeting in Seattle, Washington. One of the interesting topics this year is the treatment of macular degeneration with a newer medication that's recently been approved by the FDA, aflibercept or Healio. Now, macular degeneration, as we know, is a very debilitating condition. It's the most common cause of irreversible blindness in the developed world in the elderly population. While treatment has come a long way from no treatment at all to a handful of injections, one thing that hasn't changed in recent times is the frequency of these injections. Patients often find themselves coming back month after month after month for treatments that may or may not improve their vision. With aflibercept, the hope is that a change in the frequency interval, a reduction in the amount of injections that are needed, will be a much welcome change in this treatment strategy. In fact, at ARVO this year, you'll find 16 posters that look specifically at this topic, changing from previous treatments such as ranibizumab or bevacizumab to aflibercept. And in one of these projects is indeed ours at the University of Chicago under the mentorship of Dr. Sinu Hariprasad. What we found in our study, which is looking at so far 35 eyes of 29 patients, is that patients who have previously been treated with these medications and are switched to aflibercept, they do notice a trend towards improvement in vision, a trend towards improvement in thickness on OCT, and more importantly, what we've looked at is the quality of life of these patients. Each patient is administered a survey, the Visual Function Questionnaire, which consists of 25 questions assessing a patient's quality of life and the impact of their disease burden on their perception of their quality of life. And what we found more importantly here is that these patients often notice an improvement in these facets when they've been switched from their prior medication to aflibercept. Now, while this data is still preliminary, we do hope that as we follow these patients over the course of the year, we can develop some good insight to how this new medication and the changes in the frequency of treatment affects this cohort of patients. The other posters that we've seen regarding this topic have found some similar results in terms of improvement in vision, in terms of improvement in OCT macular thickness, but none of them has assessed quality of life like our study has, and we believe this is a very unique feature of our study, and we're excited to see what the results hold. This is Khushboo Agrawal. Thank you for watching. I have no financial disclosures.